Wearing a mask has been a source of discussion and dissension almost since the pandemic started. Now the CDC is about to weigh in on whether Americans should upgrade their mask to an N95 or something similar. And this could be the most significant update to its mask guidance since last summer when the Delta variant emerged and the agency urged all Americans to go back to wearing masks.
That's where Dr. Surani comes into this discussion, joining us live. It's so good to see you this morning. Thank you for being with us. When you heard about this look at updating the guidance, what were your thoughts?
Good morning, John Thomas. Glad to be here. I think there are a couple of things. One is that the information we know for the COVID-19 has been changing as the time goes by, the new variant comes by, and the growing months. In the beginning, I think we all know that the N95 protects you better than the regular surgical mask, which protects you better than the facial cloth covering. On the other hand, the pepper mask, like a respirator, that protects you even better than N95. The question is demand and supply. When the virus came in, it was not only contagious, but it was very lethal because we did not have any medication, no vaccination. So at that time, it was essential that the frontline worker can get some adequate protection because the supply was not there. Now we know that the virus is much more contagious, but not lethal. But again, the magnitude of the involvement in the infection is so high that it can involve a large number of public. Even the milder infection is there, but some of the people will get sick, and that even can kind of collapse the healthcare system. So now the need is that can we get an adequate mask to the general public, prevent them with a N95 or the equivalent mask, because the supply is much higher. Now the kind of a stockpile of the mask and PPE is almost 60 times the level of what we had in the pre-pandemic era. So I think that the institutions and the suppliers have been ramping up the production, as well as the conservation of that is there. So this PPE is not a major issue in the healthcare and the frontline workers. So the question is, if those things are sitting down in the warehouse, can it be better put to use in prevention? Ultimately, everyone can get the infection, but the question is that can we flatten the curve so that we don't put a strain on our already strained out healthcare system and the frontline worker and the essential worker, because a lot of them are getting sick and they're on the leave before they come back.
So Dr. Surani, should we just toss our regular blue and white cloth mask and try to look for the more upgraded masks?
If you can, you should. The question is, something is better than nothing. I think the essential question one has to take a step back and ask, is that the N95 is going to save us, or is it wearing the mask is going to save us? I think the biggest challenge we have is people don't wear the mask. And if you don't wear the mask, having an N95 in your car or in your pocket or at your home doesn't save you. Some people say that wearing even a 3-ply mask is kind of difficult to breathe. Try the N95 and try to wear it for an extended duration of time. It's really tough to wear. One of the key things is that even, that becomes very, very important, especially if you're going on an indoor and a little bit bigger gathering where you really need to protect yourself good. So I think you should be able to have those facilities with you, but the key criteria is you've got to wear the mask, get vaccinated, get boosted, and then talk about the what type of mask you're wearing. First, you have to take a step back and think, are you ready to wear the mask?
Okay, yeah, and wear it properly too. Dr. Surani, you're going to be joining us in the next half hour to discuss why there is talks about updating the vaccine that we currently have because it's not addressing the Omicron mutation. If you do have a question for Dr. Surani, please send us a text at 361-855-6397.